Welcome to Same Surgeon, Different Light. This is part of the Society of Thoracic Surgeons Surgical Hot Topics podcast. My name is Cherie Erkmen, and together with Sarah Pereira, we will meet cardiothoracic surgeons from across the spectrum of our rich community. We'll learn about backstories, career challenges, and what makes each cardiothoracic surgeon unique and valued. The opinions expressed in this podcast are those of the participants and do not necessarily reflect the views of the Society of Thoracic Surgeons.
Same Surgeon, Different Light is brought to you by the Society of Thoracic Surgeons Career Center, where you'll find free access to cardiothoracic surgery jobs, career development tools, and professional guidance. Visit the STS Career Center at careercenter.sts.org.
For today's episode of Same Surgeon, Different Light, we're delighted to have Dr. Emily Farkas. She's a pioneer in cardiac surgery, global medicine, and humanitarian efforts. She's a graduate of Pomona, Chicago Medical School, and Oxford for General Surgery Residency and Yale for Cardiothoracic Surgery Fellowship. She is currently Associate Professor of Surgery at Indiana University, Associate Director of Global Health and Surgery, and Global Cardiac Humanitarian Surgeon with CardioStart International. She has some unique accomplishments, including being named a tribal chief by the Nigerian government after restarting a cardiac surgery program that was dormant for 10 years. She has participated in over 70 humanitarian efforts around the world, and she's ascended to the highest levels of leadership in global medicine, organizing people, equipment, infrastructure, and care to people without access to cardiac care. She goes one step further by also developing sustainable cardiac surgery programs throughout the world. We're honored to have Dr. Emily Farkas. We're very pleased to have Dr. Emily Farkas join us. I've been hoping to do an in-depth interview with her for quite some time. All of her experience and travels and unique perspective is something that I'm so delighted that we can share. So I wanted to start out with thanking you and welcoming you to our format.
Well, thank you so much. It's a thrill to have this opportunity.
And tell me a little bit about your background, where you grew up and how you started.
Yeah, so it all started when I grew up in Pennsylvania, so East Coast, and I'd like to say I had kind of an academic trajectory toward college and so forth, but the truth is I remember sitting in my guidance counselor's office and looking at the book bindings, and I saw Malibu, California. And that's how I ended up at Pepperdine University. I kind of pointed at that one and said, that's where I'm headed. So that started off my education, and I actually had sort of a more creative, I think, childhood where I was focused on things like I was a ballerina and taking art classes and writing and so forth. And I wanted to study actually dance in college, and my parents set me straight pretty quickly that they weren't going to pay for that. So I ended up being a sports medicine major, which sort of introduced me to the medical side of things, and ended up reconsidering that career pathway, and here I am now. So
Were you a competitive dancer?
uh it was semi-professional was how they qualified it, but not competitive like cheerleading competitive, but like classical ballet kind of. So which is funny. I think a lot of people don't see sort of the characteristics that might be the same between a heart surgeon and a ballerina, but I think, the ability to sort of stand on your own, and also be a part of a group and blend and fit in, and the discipline and so forth. I think there probably are a few characteristics that are similar.
And so, when you pivoted away from dance, what was on your mind? What was your thought process that you dedicated so much of your time to one discipline and now you have to find another?
Yeah, so it's interesting because sports medicine had, the kinesiology and the biomechanics and the exercise physiology and the things that, were the side of my brain that I really hadn't stretched very much, I think, growing up, always leaning on the creative side. And I think it just, it sort of opened my eyes up to something that was compelling to me, and I went down that pathway toward medical school. And once I got through that barrier, moving into, deciding what to do for the rest of your life was surgery was a pretty easy decision for me. And I think cardiac surgery came pretty naturally as well.
So, what
And
gave you the inspiration to even try for medicine? As you alluded to, it's if anything a barrier to get in, and challenging to even think that you have the ability to do that. What gave you the inspiration and motivation at this time?
yeah, I think, well, it was probably multifactorial. One of the things is my aspirations to be a professional ballerina. Those career paths are over in your late 20s, right? Because of the rigorous sort of physical element to being a professional. And so if I were even going to pursue that, it was going to be over pretty quickly. And so just looking at something that had more longevity and probably more promise for the future, medicine really did interest me when I saw it from that perspective of, coming from the sports medicine side. So I think it was probably a mix of a few different things.
Did you have people guiding you in that direction?
Not really. So, no one in my family was in medicine before, and I was the first, and so it was. I definitely surprised everyone when I came home and sort of said, "Well, I think I'm going to go down this pathway." It wasn't what anyone had expected, and maybe it wasn't what I had expected either. But once I committed to it, it really felt like it was the right pathway for me.
So, same question for deciding on surgery, and cardiac surgery in particular. There um, are, again, a lot of challenges to entering in the field. And how did you get the impression that you could do this and that you wanted to do it?
Yeah, I remember in residency really sort of giving, I did the traditional general surgery residency, and I can remember like really giving everything a fair shake. I mean, seeing if vascular was something that spoke to me, so to speak, and or if, any other field really stood out. But the thing that I saw in cardiac was really the connections. So, I think the connections with your patients and your families was like nothing else I saw in the other fields. Not that, oncology surgery and, there's so many different ways to have an impact on someone's life. But when you're stopping and starting someone's heart, I felt like you really like the leap of faith that a patient and a family has to take to put their trust in you was just so striking to me. And I really felt like it was just something so just like nothing else. So that really appealed to me. The other connections I think that were important were in the operating room. I felt like you have this like really expert team and the esprit de corps amongst every member, whether it's perfusion or anesthesia or, the assistants in the OR, everyone matters. You may be the captain of that ship, but it's a group effort when the outcomes are favorable and when they're unfavorable, and every person relies on the other, and you're in the trenches with them. And I really like that sort of family that was created in the cardiac operating room.
So, I see kind of a recurring theme that you're choosing something that's very, very challenging, and perhaps something that you don't have a lot of structure or guidance for people before you who've done this. So, how do you come to do it? How do you get past the naysayers, and the fact that there's not a paradigm for you?
Yeah, I think that's a great question that comes up a lot, and I think we all probably have had a bit of noise in the background when you're making these kinds of career decisions. and there are a lot of diminishers out there, right? There aren't as many multipliers or magnifiers. And so you really do have to sort through all of that. And I certainly had that. I had people say, well, my goodness, you're not going to be able to, you're going to prematurely age if you go into surgery, all that call, or you're going to, you're not going to be able to do the things you want to do in life if you commit so much to a career like surgery or cardiac surgery. There's plenty of noise. I think what I've learned in many different areas of my life is that you have to be able to extrapolate from incomplete data. There weren't a lot of role models around, but there were enough that I think I could fill in the gaps and sort of read between the lines that I could see in those that may not look like me or may not, have the exact pathway that I was looking for. I could see what it would mean if I were to follow in their footsteps. And I think you just have to have a little bit of faith, right? You just have to have the courage to go in a pathway that you feel like is the right one for you, and be able to course correct if need be. And gratefully, I didn't need to, but I was ready if that was going to be the case.
So this mindset is good for cardiac surgery. Has it ever failed you that you put your mind on something and you're working toward it? People say you can't do it. It was a failure in some way or a goal that you didn't achieve.
I think probably what comes to mind really is that it was scary, sort of. I mean, now I'm getting into sort of my pathway toward global surgery, which I'm sure will come up here. But my first position after training at Yale was at St. Louis University, and I was on the faculty there for 5 years, and I felt like I'd been given this pedigree at Yale of kind of creating division leaders or department leaders or chairs of departments. And I just felt like that really wasn't that's amazing and fantastic. I respect and admire it, but that wasn't what really got me out of bed in the morning. I mean, there were different things that motivated me about our field and our career. And so, and that was really being able to do global humanitarian surgery. And so 5 years into my, first job at SLU, I call it going rogue, where I jumped ship and tried to find a way to have more time to be able to do global humanitarian surgery than I was able to do in that first job of mine. And that was really scary because I really felt like there really wasn't a pathway ahead of me, and I wasn't sure this was the right thing to do. And I felt like there was a lot of scrutiny, being the first female at Yale, I felt like there was this microscope on me that in cardiac surgery, not ever, but in cardiac surgery, felt like there was this microscope, like, let's see what happens here. This was I always joke that they, after I graduated, they didn't have females for several years after me. And I thought maybe I'd ruined it for everyone, that it was a failed experiment. But I just felt like there was a lot of pressure that maybe I created myself. But when I made that jump, I didn't know if I would land where I wanted to. And for the first several years, for instance, like at society meetings, people would say like, where are you working or what are you doing? And like trying to explain like how I was kind of working half time in the US and half time overseas. It was really like, I felt like there was a lot of people just didn't understand it, and it just wasn't the normal trajectory. And surgery is very rigid, right? So I think thinking outside the box was not something that many of our colleagues, at least career wise, are accustomed to doing, because we have so many milestones and metrics and so forth. But so I think that was, it's a roundabout way of answering that. It was, I didn't know that it was the right thing to do. And luckily, I landed on my feet, but it could have been, a real, questionable time in my career if I wasn't able to remain relevant in the US as I started working overseas and that type of thing.
So this was an intentional pivot. You're in your job, you're happy that you felt this is not what I want. I need to change. Talk me through that a little bit because I think that takes a lot of courage.
Yeah, I think opportunity expands in proportion to your courage, but I agree that it did take a lot of courage to do that. I think that we talk a lot about burnout. We have colleagues that, are really just at the end of their rope in our field and other fields. And it's not because we don't love what we do. I think that we all love what we do, but we forget why we do it a lot in the hustle and bustle of every day and the kind of the chaos that can ensue in our daily lives. We forget, right? Why we made this choice in the first place, why it was so meaningful to us. For me, what I was recognizing, I was doing, mission trips on my vacation time, which was like 2 or 3 weeks a year. It was all I could do when I was at St. Louis University. And what I realized is when I was there, when I was in a place where there were, no other options for cardiac surgery, and the sort of the impact I was able to have on a family, that's what resonated with me and reminded me why I did this, why we started, 15 years ago with all this training, and why we jumped through all these hoops. And so I think you do have to have the courage to really look at that in yourself. Not obviously this is not the pathway for everyone, but it has to be something that really makes you think that I'm willing to take the risk because the fulfillment that I can get on the back end of this is going to be everything. So I made that jump.
And when you're first exploring the 2 week and 3 week mission experiences, like when did you start getting this global training and experience?
So it's interesting. When I was in medical school, actually, I remember walking by the guidance counselor's office, and they had this billboard, and there was a advertisement for this group called Operation Crossroads Africa, and it was basically to volunteer with a group of healthcare providers in Kenya, Tanzania, and Uganda. And I went to my teachers and said, can I have a few weeks off the end of my first year, a few weeks off the beginning of my second, and the summer in between to just do this. Like, this feels like something that I want to be part of my career. And remarkably, they said yes. And so another lesson is, just ask the questions. Sometimes you're afraid to push the boundaries, but sometimes you just need to try to push. And so I had this opportunity. I was completely useless, right? I was a medical student, first year medical student. So it's not like I was providing any high level clinical care. But what happened was, I mean, it really opened my eyes to what we can do with our skill set. And even though we were treating like malaria and amoebiasis, and I did deliver my first baby in Kenya, not mine, but someone else's. And it opened my eyes to, like, okay, we've been given this gift, this skill set that crosses borders, that doesn't matter what your socioeconomic status is. You can use these skills anywhere in the world. And for me, I was like, note to self, this matters. I had to dive right back into, the rest of medical school and getting my sea legs under me. But that made an impression on me. And so my fourth year rotations in medical school, like, I went to Sri Lanka and did my first splenectomy on a man that was lying underneath a palm tree, and a coconut fell on his side and ruptured his spleen. So, um, like, I had these experiences early in my career that they weren't specific, obviously, to cardiac surgery, but they were just to medicine in general. You can do more, you can think outside the box, and you can craft a career that maybe is a little different than the rigid way we look at cardiac surgery.
Did you think that pursuing global medicine was uh, cardiac surgery or global medicine? Did you ever feel like it would have to be a trade-off?
I well, it is a trade-off. It is a trade-off in some ways, and I'll tell you that, for instance, the way that I've made it work in the U.S. initially, when I talked about jumping ship from St. Louis University, I had to go into the private sector and really I had to seek out a hospital that was willing to have a half-time heart surgeon, basically, right? So, and when I was there, it was basically, I was working 2 weeks in the US, 2 weeks on, then 2 weeks off. And so when I was there, I was on call, every day for 2 weeks. I mentioned I had to be completely operative, like really staying relevant with structural heart and with, newer techniques, and keeping myself busy in the operating room, because I had to gain the skills in half the time, really, and the volume in half the time to be able to um, be outside of my comfort zone, then doing the same thing. So I think I had to be really intentional about the way those next several years played out. But I think that the trade-off for me was, okay, I'm gonna work half time in the US. I'm gonna be paid half time in the US, right? That's a big trade-off, I should probably mention. So not everyone's, able or willing to, with families and all the other responsibilities, able to make that trade-off. But to me, to have the flexibility of the time and the opportunity to develop this part of the global side of my career was like a gift. So that trade-off was really worth it to me.
How did you approach CEOs of hospitals or deans? This is a totally different paradigm. And how hard did you have to work to find a receptive employer?
It wasn't easy. I think, and it had, for instance, I was in, the Midwest, maybe an area where it's harder to find staff unless they have a local connection to a certain area. So those are the places that I targeted, because those were the ones that were maybe willing to think creatively about a way to make this work. But I think what I also targeted was most programs, find themselves, they either have um, you know, maybe they have two surgeons, and they really could use maybe 2.5 FTEs, but to have a third full-time surgeon was too much. So they didn't have enough volume to support a full third-time person, but they had too much volume for only two. And so that kind of like that sweet spot, I think that was an area that a lot of hospitals, I think, struggle with. And so I think you can optimize that by pointing out, this is what I can offer, which is to narrow that gap, and without over investing in a full-time third surgeon.
So that's the US and hospital clinical side. How did you find the right partner for global medicine and what you wanted to do?
Yeah, so when I finished my training, I immediately looked for NGOs or non-governmental organizations, charities around the world that were really doing cardiovascular work. And there are several, but still it's a limited a limited field. And I immediately just connected myself with one of the bigger charities, which was called CardioStart International, and they'd been doing global cardiac care for 20 plus years. And so I felt like there was there's really some mentorship there in kind of developing that side of the profession. And so I started going with them as a second surgeon, and then maybe as the lead surgeon, and then maybe as the mission coordinator, and then as the director, and finally on the board, and all the other things. So I mean, it was a process as well, a learning process.
How did you choose different organizations? You said there are a few out there. And how much did you have to um, explore and research what was right for you? And how much did you have to create something that was right for you?
Yeah, well, one thing that probably limits many people who are looking into this is many of them do only pediatric cardiac surgery, and I wanted an organization that was doing both. So that limited it down to just a few organizations, of which I'm aware, that were regularly doing both pediatric and both adult cardiac surgery internationally. So that was important to me. The other thing was sort of their track record, how long they'd been doing this, what their sort of model is. So there are some organizations that, fulfill a need by coming into a place that does not have cardiac surgery and just bringing an entire team and just serving patients by doing whatever 20 operations in a few weeks. But for me, what felt more meaningful was to be really investing in the upskilling of a local team that, had a lot of the pieces in place, but just needed to take it to the next level by one-to-one skilled training in all the key areas of cardiac surgery. And so that was important to me, that was the model an organization utilized, and CardioStart did that. So I think that was probably one of the key things that attracted me to them.
And now, today, can you just describe how you make it work? Because it seems insurmountable, the amount of travel that you do. How do you keep a household? How do you keep your patients happy, both here and abroad? How does this work?
So, well, so a few years ago, I was really fortunate, I think, to have IU, Indiana University, reach out to me because one thing was I never thought I could do this in the academic sector. I thought I was going to need to stay in the private sector, as I had mentioned when I initially left St. Louis, because I just didn't see, the negotiating ability and the creativity is not always there, I think, in a big university machine. But they reached out to me in this context. The division chair, Mark Turrentine, is a big global surgery surgeon himself, really. He's done 40 plus missions in his career, and probably more actually at this point. But he really saw the ability, I think, to craft something that would work in the academic sector. And so the Veterans Hospital here in Indianapolis that's connected to IU had kind of fallen apart in the last several years, and they needed someone to sort of restart that and reboot that. And in some ways, with the low resources that we often find in maybe in the government sector, it was almost similar to to some of our, mission challenges that we have, or just getting things set up from the beginning again. So he thought that was a good match. I also think the veterans are an underserved population, and to me, it felt like that was a good match for me to be able to provide high level care here. And the other thing was it allowed me the opportunity to negotiate on that front end. Like, this is what, here's how how I would love for this to work out, is if I have so many weeks here and then so many weeks to be able to do the global work. And they actually even had a program in Kenya that they're attached to in Eldoret, Kenya. That's part of the an academic consortium of North American universities that have exchange with this university, and they develop cardiology and pediatric surgery in many different fields, and they needed someone to develop cardiac surgery. So basically, I walked into this situation that allowed me to craft a part-time sort of arrangement here with an academic component to it. So I felt really grateful for that. So that's the first piece. The second piece is, how do you make it work? So I mean, I'm a hot mess. Let me just say that right out front. I mean, my time management skills could be better. I mean, I am like just here, there, and everywhere. I've just gotten back from Ghana and Egypt 2 days ago, and I leave for Kenya on Friday. And so, I mean, I am just everywhere. So what it takes is people supporting. I think around, like, my team here is amazing, that they tolerate me and they tolerate these crazy schedules, and they optimize everything so that we get as many operations in as we can when I'm here. And I have to trust in my partners at IU that they're here for the patients if something should happen while I'm away. So there's a lot of people in the background that really make it work. It just has to be, personally, when we talk about trade-offs, I mean, one of the trade-offs, I guess, that you could say I have is that I don't have children. And I'd like to point out that that's a choice. And, it doesn't mean that you can't do this career and have children. I mean, absolutely. You just have to be more intentional about it and have better time management skills than I do. But, that's one of the bigger trade-offs. But I don't have the responsibility of, like, kids needing to be in school, or, worrying about vacations and these kinds of things. Um, and I also like to think that, if the definition of a mother is giving life to, or giving whatever you can to a child, that maybe I'm a mother to children all over the world because of the ones I've been fortunate enough to operate on. So I think you just, these things are always kind of going through my head. Like, how to make it all work. And I do the best I can, but it's really because I have a lot of people supporting me in the background.
Have you ever experienced any negative feelings about your absence or, not being able to meet all the expectations because people are used to this type of cardiac surgeon?
Yeah, I mean, I think that there's definitely some scrutiny, especially when you don't realize what the purpose is. I mean, if people think I'm just off, in Aruba vacationing, I mean, that's one thing. But I think as soon as people really understand what the purpose is, and what I'm really trying to achieve is to pay it forward and to give back, um, I think they become a lot more gracious, and I'm grateful for it because it really does take a lot of concessions, I think, sometimes on the patients, when even though I don't schedule an operation right before I'm leaving, sometimes by necessity people happen to still be in the hospital when I have a scheduled mission, and I'm always, telling them this isn't what I planned, but I trust my colleagues and they're going to take great care of you and I'm going to be checking in. But I always feel like I don't want patients to think I'm abandoning them. And I would say 99.5% of the time, people are so gracious, and they feel like they're part of something, um, as well, because their surgeon is, going to give back in Mozambique or Nigeria or whatever. I think they take some pride in it, which is really special for me. So that's the way I've handled it.
Do you ever feel that you abandoned somebody, either here or globally?
Yeah, so great question on the other side, right? So we by necessity only stay in a certain location for a determined amount of time, and there, commonly, if not always, are people that are still in the ICU when we leave a country. Um, and and that's my leap of faith, right? So that's definitely a challenge on my end. Before we ever do the first operation, we know that we have, our expectations are set in both directions. So I know that I have key stakeholders there that are going to, you know, jump right in and take ownership of those patients and communicate with us constantly if there's any question about management or anything that we can do to help influence the care. But at some point you have to trust your partners, and these colleagues that we're working with in low and middle income countries are, I mean, they're some of my closest friends now, because we're again in the trenches together, and we're sharing this like huge challenge, which is to, you know, upskill their entire teams to serve their own communities. So I'm investing my time in them, they're investing in their community, and it's like a trade-off that I think we both, it's like a bond, we've entered into it together. It's hard for me to leave because all surgeons are possessive, but I have to have faith in them, and I do.
Have you ever felt that the patient care suffered because you physically weren't there?
There's a, yes. And I think we probably all suffer a little bit from that, even if you go on vacation in the United States, right? And you love and trust and admire your partners, everyone makes decisions a little bit differently. And most times the end result is exactly the same. It's just the way that you would have gotten there might have been a little bit different. So have there been times when I think, well, if our team was still there, maybe this pneumonia wouldn't have set in, or maybe we would have gotten them out of bed more, and uh, they wouldn't have gotten a DVT, or there's always, I think it's a sign of a responsible clinician, right? You're always like, what is it that I could be doing differently, or what can we learn from this, and how can we prevent these things from happening in the future? So there's absolutely been times when I think, well, if I were there, would it have been different? But maybe it would have been worse. Who knows? You have to be fair. You have to think of it in both directions. So I think like I said, you just have to have faith in your partners, and that's a hard one. But I know it goes both ways. They probably have the same concerns about me as well.
And what about the other parts of clinical care in global medicine, you are talking about resources and money, infrastructure, trained people. How much are you involved with that side um, of your, of the work that you do?
Yeah, well, it's called kind of one package, it's when we start, for instance, when we, commit to a site or a location or a program community, we, do sort of an intake scout visit looking at like where the gaps are, where are the, the opportunities to make things safer, what do we need to ask for, donate, contribute, ship, carry in our suitcases? Like, what is it that we need to do to make everything safer? And there are just so many. I mean, this could be an entire topic. There's so many considerations that go into this because you don't want to just get donations of Medtronic valves for the next 5 years. You need to develop a supply chain in a way that, you actually support the industry that's going to build the program around you. Like, you can't just, come in and donate everything. You need to think a bit strategically about those things. So, you know, um, I'd say a full half of the time that I'm not in other countries, I'm thinking about, those strategic questions, like what do we really need? How do we get them? How does that affect the local ecosystem? What's the next step? I mean, there's so many subtleties that go into building a program and taking it to the next level. So that's definitely, it's not just coming in and doing the operation and leaving. It's there's a lot more to it.
And um, I mean, this is a huge responsibility, both from your work at the VA, and then developing and program building, and then doing the cardiac surgery globally. Is this a sustainable life for you?
Yeah, I mean, I think that's a fair question. I think unless I, can't travel anymore or they fire me because I'm away too much, it's definitely, the way I see my career being sustained. Because to me, um, I can't think of a way that really like fulfills me more professionally and personally more than this. Like, I feel like I live a charmed life to be able to craft my career this way. So, like I said, unless I get, like, I don't know, West Nile virus or something takes me down where I can't, travel the way I do, it's like a part of who I am. And I really, and I think it's a part of the surgeon that I am. It's like the pandemic was devastating for a lot of reasons outside of this. But for me, it took away that identity for me of like, this is this is what makes me tick, is being able to work with our colleagues in these other countries, and I couldn't travel and they weren't able to, do as much as they could when they were being when we were collaborating. And it really, like, when that was taken away sort of acutely, I was like, okay, let me find my footing here because this is what I identify with. So it's really it's how I see my career playing out until someone takes it away from me.
So, you go to a lot of different locations, and you have to be open-minded, not just clinically and in terms of infrastructure, but also culturally. Has there ever been a time when you didn't feel comfortable in the place where you were?
You know, I feel like there should have been times, although I really I can't remember ever feeling threatened. Now, that's in the context of, for instance, when we used to go to a pretty rural part of Nigeria, there was a faction of the Nigerian police called the Scorpion Patrol that was with us 24/7. And so they had, AK-47s on the front and machetes on their back and the boots and the helmets and all the things. And they would sleep in the parking lot of our hotel at night, and then they would escort us to the hospital, and we'd be there from 8 in the morning till midnight, and they'd be walking the halls, waiting for us to finish. And that either makes you feel safer than you've ever felt before, or a little bit startled that maybe you need that degree of of support. And I don't know that we needed it, but it was a government hospital, and they felt like it was their responsibility to be sure that nothing or to interfere with our mission, really. And so moments like those, I guess, when I look back on them, I think, well, maybe I should have been a little alarmed by that. But the truth is, like, it's naive, but I feel like I am there, like I am here to just give back and to help. And so um I'm just, it's almost like service over self, and not in a like self-aggrandizing way, just in like I'm focused on like this is what I'm here to do. I'm not really focused on my own safety, whether I should be or I shouldn't be. I definitely need to think about the other volunteers that I've brought with me. That's a big responsibility. But for me personally, I haven't ever felt threatened.
And on the other side, has there ever been a time when a people, a person, or group wasn't accepting of the intentions that you had?
Yeah, that's another good question, and I think people don't always understand it, and they're not always sure what to do with me in particular. Like, I mean, there are many places where um, females take a more demure kind of role in culture and in professional life, and to have a female cardiac surgeon come in and leading a kind of an effort like this sometimes can come off a little strong. I'm very cognizant of the way I'm being received and the way culturally I think I can be affecting the people around me. So and I think that's something maybe we all do as female surgeons without even thinking about it. I think you have to be a little more conscious of reading a room and how you're affecting the people around you, right or wrong. I think that's just probably part of what's happened in growing up in a field that's mainly male dominated, right? And so I think maybe I take some of that in, and I'm always conscious of what's happening around me and how I'm being received. But I think I've never felt like it wasn't um taken appropriately. I just felt like maybe there was some like confusion and a little bit of like, well, this is a surprise, or what do we do with this, or that kind of reaction, but always landed in the right place.
And so you have, like you said, just this charmed situation. You're able to fulfill all of these goals. Do you think this is a model that others can use, or have you mentored other people through this?
Yeah, I do. I mean, I think, there are a lot of young surgeons that I think have an interest in this. And I really do think that it's a model that can be replicated because there's a precedent perhaps of not just me, but I often counsel them to look around them in like plastic surgery or ENT or orthopedics, or I mean, there are surgeons out there that are doing quite a lot of global surgery, and they've found unique ways within their own specialty to navigate it and have, sometimes you just talk to hospital administration and you'd be surprised at how willing they are to maybe give you time to make this part of your career. I think, like I said, you just have to have the courage to ask those questions and not just use your own tribe, but use the people outside of your specialty who may have stumbled across a way to make this kind of career work. And it doesn't have to be, like me, half time and half time. It could be quarter time or eighth time, or, think about what works. I usually counsel young surgeons, think about what works and then come in negotiating that way on the front end, because that's when you have the most leverage, as as for anything else, just like protected research time or, whatever it is that you think is important. If this is an important part of what you think the future of your career is, then make this a negotiating point, because in the end, I mean, it serves the hospitals to have, I think, someone who is, trying to do something a little bit different than what maybe the rest of the faculty may be doing. I mean, it diversifies them. It gives them a feather in their cap. There's a reason to support it, and so I think it is sustainable if you are really intentional about it from the front.
And how much does a political change, either nationally or globally, affect the work that you do? So you've been doing this through several administrations. Have you sensed that there's an ebb and flow, or is it carrying on?
Yeah, I think, personally, these smaller charities and these non-governmental organizations really aren't affected as much by the politics. Certainly, there's reason to have concern in the last few months, but I think the targets are on much bigger kind of charitable organizations as opposed to kind of the smaller, grassroots kind of organizations that are really just doing the work. And they're not asking for, I mean, this is, non-governmental by definition. And so we don't really rely on support in that regard. So I haven't personally seen it affect what we're doing, and I hope I continue not to see that in the future.
Right. Um, so I wanted to ask, and that's speaking to the future, and this is a question we ask of a lot of people. Where do you see cardiac surgery, cardiothoracic surgery going in the future?
It's interesting when you ask me that question. Where I see it going is globally. I don't see, I don't think, oh, it's going to be this technique or this approach or this technology. Where I see it is in access and in, the innovation, if I try to think of it that way, is in how we pass along training and skills and how we can expand the way that our colleagues can serve their communities around the world. So if you ask me, how do I see it in the future? That's where I see it. I see it in Nigeria and Ghana and Tanzania and Nepal, and I see it not just in one hospital serving an entire country, but in many hospitals, and that to me is a bright future in cardiac surgery.
Thank you. A lot of people know you for your work, but I think not many people know what you do outside of everything that you've discussed today is work, right? So tell me a little bit about where you spend your free time.
Well, some may know that I try to climb one mountain per year. So the only travel that I usually do that's not not a mission is for a mountaineering event. And in fact, it's funny that part of the reason I think that I started thinking creatively about my career was being on Mount Everest when I was with this um, amazing family practitioner who had become like a mountain medicine sort of specialist. And I remember where I was on Mount Everest when he said to me, if you're bold enough, if you're arrogant enough, or if you're stupid enough, anyone can create an individualized career in medicine. And so here I am, like on this mountain and thinking, like, how did this, this was new to me that we could sort of, think outside the lines and create a career that's different. And so, anyway, that I think that's probably how it all started. But so you find lessons in life, I think, out on the mountains or in other places that maybe relate to your profession that you wouldn't even expect. I'm constantly being taught things when I'm on a mountain that I think somehow apply to to persevering and being creative. And like I said, extrapolating from incomplete information. You have to do all those things like when you're climbing a mountain. So that's the one thing I think people may or may not know about me that is the biggest pastime that I have instead of mission work.
And thank you so much for being here. I do want to ask you one last question, whether it's professionally or personally. What's your next big challenge?
Yeah, well, I guess since we're talking personally, it is a mountain and it's called Ama de Blanc and it's in the Himalaya and it's a nice technical climb. And like I said, I think there are a lot of parallels in life to mountain climbing. Like if you think you've summited, you need to find a new mountain. And so I think that's kind of where I'm at in my career. I think I'm really grateful for where I am, but I need to think about ways to be more visible maybe to more trainees and students and young doctors who maybe want to follow a pathway like this? And what can I do to encourage and illuminate, a career pathway like that for others? So those would be the two things, I guess, that personally and professionally I'm looking toward.
Thank you. Thank you so much for your time. Maybe you'll be interested in taking on older surgeon mentees. like like I would definitely join you. I'd love to learn more about what you do. I'm so inspired by our conversation today. And like I said, I've been looking forward to learning a little bit more about how you make it work. And it's truly inspiring, and it's also wonderful to see how humble you are about all of these wonderful accomplishments and contributions that you've made globally. So thank you for who you are and what you do.
Thank you so much. It's been my pleasure. And don't tease me. I'll have you packed up and ready to go on a trip here in a few weeks.
Thank you.
Thank you.
This has been Same Surgeon, Different Light, a podcast brought to you by the Society of Thoracic Surgeons. Thank you for listening. If you like this podcast, please rate it 5 stars and let your friends, trainees, and colleagues know about it. On social media, you can use the hashtag #TheFaceOfCT And for more information about the Society of Thoracic Surgeons, you can go online at sts.org.